morning. I am hostess Lakia Thompson.
And I'm her co host, Candia Darling. Today's special news report is due as a partial fulfillment of our Microbiology 223 Summer 2025 course.
Our news report today will be educating you all about Zika virus in the Bahamas, the disease, symptoms, vector control, ways of prevention, and the impact on our overall health.
Zika is an illness caused by the Zika virus. Most people infected by the virus develop mild symptoms. However, it can cause serious conditions. Some persons affected by Zika can develop Guillain-Barré syndrome, a rare but serious illness of the nervous system, which causes nerve damage brought on by a person's own immune system. It can also cause severe muscle weakness and paralysis in some people. Pregnant women are also at high risk as the virus can pass on to her newborn child, resulting in fetal death or congenital Zika syndrome. Babies born with this condition experience stiff muscles, seizures, hearing loss, and microcephaly, in which the baby's brain doesn't fully develop and the head being smaller than usual. Oh, just trying to get some rosemary to cook. Oh, oh, man, I missed that mosquito.
3 days later.
Hi, good day, Miss Darling. How can I help you?
Oh, doctor, I've been feeling so bad lately. I've been having migraines, and my temperature just feels so high. I don't know what's happening.
Oh, wow. Okay, so I know we have a few cases of Zika virus going on, but did you attend any outdoor events this weekend?
Not really, but I was in my garden about 3 days ago cutting rosemary to cook, and then I got bit from a mosquito.
All right, so do you have any blushes or anything on your skin?
Yes, this is where I got bit.
Oh, wow. Okay, so I'm going to take your temperature. Okay, so your temperature seems to be pretty high. I think we're gonna have to admit you for a day or two. We're gonna have to run some blood tests. And I see that you're pregnant. We don't want the baby to get infected by this Zika virus, okay? So we're gonna make sure that we run the tests necessary to avoid any harm to the baby as well, okay?
Thank you, doctor.
All right.
Most notable symptoms of persons infected with Zika virus consist of sore joints and muscles, high temperature, rash, headache, pink eye, and weakness. These symptoms are often developed 2 to 7 days after infection. The Aedes aegypti mosquito is the vector responsible for spreading the Zika virus. This mosquito is an arthropod, also considered a part of the insect family. The female mosquitoes are the sole biters that feed mostly during the daytime. The mosquito can be recognized by its black color with white stripes on its legs and body.
The Aedes aegypti mosquito can be found across the entire Bahamas, rather in communities that consist of old tires, trash, long-lasting uncovered water containers, and flower pots with built-up water. This is especially important why we should keep our environment clean. The disease is transmitted when the mosquito bites an already infected individual with Zika virus. the virus then increases in number inside the mosquito. When the mosquito goes on to bite another individual, the virus is transmitted from the saliva of the mosquito to the individual. Additionally, the infection can spread by blood transfusion from a pregnant mother to her child and through sexual transmission from partner to partner. In accordance with Zika virus in 2017, there were 25 overall cases in the Bahamas. 23 of those cases were recorded in New Providence, one in Bimini, and one on the island of Eleuthera. Everyone is at risk of mosquito bites, but specific individuals inhabit more consequences, such as pregnant women and their newborns, outdoor workers like farmers, landscapers, and even construction workers. Also, people with weaker immune systems, such as the elderly. New Providence has had the highest recorded number of Zika virus cases in the Bahamas due to higher population, acceptable conditions, and constant travel of tourists in and out of the country. Rainy seasons can also have an impact on the growth population of the mosquitoes. We will now switch over to my co-host, Candia, who will be on the grounds educating others about the dress code for mosquito-populated areas.
Thank you, Lakia. To avoid being bitten, persons should use insect repellents like off and wear light colored clothing that cover most of the body, including caps, long shirts, pants, or skirts when going outdoors. Before leaving the house, spraying indoors, especially in dark areas where mosquitoes like to hide, such as closets and under beds, are also encouraged, along with keeping doors and windows closed. You can do your part to help control the spread of Zika virus by removing buckets, old tires, and any standing water containers from around the home or community to minimize mosquito reproduction. The Department of Environmental Health has committed to and is assisting with treatment of water sources and mosquito fogging throughout communities. If you or someone you know is bitten by a mosquito and develops symptoms associated with Zika, it's important to seek medical help immediately. In accordance with Tourism Today, a briefing was carried out with focus on Zika prevention measures and tips to eliminate mosquito breeding around hotels where guests may reside.
The public can get involved and assist by joining community efforts such as keeping their environment clean, hosting Zika awareness campaigns in schools, educating others on social media, and staying updated with new information pertaining to Zika virus.
As citizens of the Bahamas, we can protect our health and family by adhering to protocols while educating others on the risk of the disease. Collectively, we can combat Zika if we act fast.